Okay, well, let's get going. Welcome all to the Rural Places Matter Caucus. Um, I am Kathleen Stein, the St. Lawrence County Mall Unit, and the convener of the caucus. And you know, thanks to Judy Esterquest and Leanne Hirabashi and Barb Harrison for their help putting this convention caucus together. First, some housekeeping, the usual housekeeping. Please mute yourself unless you are speaking. And please also put your name and the name of your league in the chat. Be nice to have all that. We will have time for some quick Q&A after each of the three presentations, and hopefully, some more time at the end as well. Please put your questions in the chat, and then we'll call on you during the Q&A period. The Rural Caucus was started 1 year ago this month with the aim of creating a space where rural leagues could share information and lore about doing league work in rural New York. We also work to further advocacy for rural issues at the league state level. Members of the caucus, and we have a map here showing all of the counties that are represented, the Allegheny Cattaraugus Mall Unit, Broome, Tioga, Cooperstown area, Geneva, North Country, Oneonta, and Rensselaer leagues, the St. Lawrence County Mall Unit, as I mentioned. We've got people from Tompkins, Westchester, a member from Jefferson County. So we have 16 New York counties are represented in all. If you would like to join us, and you don't have to come from a rural league, just be interested in rural issues, get in touch with any of us. I've also put my email here, but Leanne and Judy will put their emails in the chat. As stated in the convention kit, 86.6% of New York's land mass is classified as rural by the New York State Senate. But since most New Yorkers live in cities, they are often unaware of the problems endemic to rural areas. Some of us are also working to organize a rural caucus, rural affairs caucus on the national level of league members. And as part of our outreach for that effort, we did a survey of interested league members, and special thanks to Judy Esterquest of Port Washington Manhasset League and Barbara Pearson of the Amherst, Massachusetts League for designing and running that survey. We got over 60 responses from 30 states. Again, map here showing the states. One question on the survey asked respondents to list the top 5 challenges they saw facing their rural areas. The top 2 vote getters, as you can see, were healthcare and broadband access. A recurring theme in additional comments in the additional comments section of the survey was the difficulty of advocating for league priorities in our often very conservative rural communities. And those are the 3 topics that we're going to discuss this evening. Now I'm going to stop my share, and Judy Esterquest is going to start off with rural healthcare issues here.
Put mine up. So my name is Judy Esterquest, and I'm the healthcare chair of my Long Island League. And I served on the statewide committee to update our league positions. And let's see. Where one of the areas that we were most concerned with involved rural New Yorkers and how they're currently underserved, even harmed by our current healthcare system. So I'm delighted to share some of this with you tonight. I'll be discussing 5 areas. You can turn next slide. Highlights of our current position, a bit of context for what rural means, a snapshot of rural health challenges, their causes, and paths forward. So what's new with our league positions? Next slide, please. The fundamental 1991 goals of universal, accessible, equitable, and affordable healthcare remain, with a few areas more explicit. Separating healthcare coverage from employment, which every other developed country does. We broadened the definition of essential coverage to include everyone, what Medicaid offers poor children, vision, dental, hearing. And we added long-term care, particularly home care, to allow seniors to age at home without impoverishing themselves into Medicaid, to help family members, especially females, continue working and or get paid for the significant services they provide, and to help disabled adults remain productive and healthy. We also define some financing issues more explicitly, favoring public funding and specific cost control methods. These new positions call for all New Yorkers to have access to the health care they need, regardless of where they live in the state or their ability to pay. Just to state what the pandemic has made obvious, marginalized New Yorkers, this includes rural New Yorkers, have died at 2 to 3 times the rate of other New Yorkers, largely because of worse health. Losing health care for your family when you lose your job can be tragic for the family, but it also increases the public health risk for all of us. Even brief hospitalizations can bring financial ruin and destroy lives. If you have questions about any of this, please put them in the chat. But let's begin by asking, what does rural mean? Today, about 20% of Americans, which is also true in New York, live in rural areas, defined by the Census Bureau as areas with fewer than 250 people per square mile. Urban areas have populations of 50,000 or more, whereas the Upper East Side of Manhattan has about 168,000 per square mile. Remember that, 168,000 per square mile. So where is New York State rural? Next slide. You can see New York City and Nassau County, where I live, as bright red. That red area has 50% of our state's population. Another 30% live in the red dots running west to east along the path of the Erie Canal, Buffalo, Rochester, Syracuse, Ithaca, Albany, and the Hudson River cities. That big green area north of Albany, that's the Adirondacks. All the rest of the state's area, 80%, is home to 20% of us who are rural, with 50 to 250 people per square mile. So how does the health of rural residents compare? Next. You'll hear people say that rural residents have worse health because they're disproportionately elderly and growing older as rural areas have fewer births and more out-migration. But is that true? Well, no. Next. Rural area residents die on average 3 years sooner than residents of large urban and suburban areas. But why? Interesting. Next. The 5 leading causes of death are the same for urban and rural Americans. Unintentional injuries, by the way, do not include homicide or suicide. Note it's typically traffic accidents. Note that the urban and suburban areas, death rates per 10,000 have dropped significantly over recent decades because of access to good health, education, and modern medicine. But for rural residents, death rates are 2.5 times higher for heart disease, 4 times higher for cancer, 3 times higher for lower respiratory diseases. I find these differences astonishing and heartbreaking. Rural residents are not benefiting from medical interventions that are decades old. Next, a rural mom in New York State is 60% more likely to die. Rural infants suffer similarly tragic higher death rates. Moving on, we all know that life expectancy depends on nutrition. Next, well, 1/3 of rural seniors have no teeth, almost 50% more than urban seniors. And Medicare does not pay for most dental procedures, not dentures, not implants. A recent study concluded that the risk of death tripled for people with no teeth over those with 20 or more, and it doubled for those who had lost some teeth, but not all. Also note that twice as many practicing dentists in urban areas as in rural areas, and those fewer dentists are spread over larger distances. For rural areas, we're talking fewer than 1 dentist per county. It's no wonder that 70% of Americans suffering dental problems haven't seen a dentist in a year. Also, hearing. Medicare doesn't pay for hearing aids. Rural areas have few specialists, and 70% of adults need hearing aids go without. These New Yorkers are at higher risk of depression, dementia, and falls, which, as we know for seniors, too often lead to death. What's going wrong then for rural residents? Well, once upon a time, country living was healthier than now. Next, although New York State has protected access better than most states, rural New Yorkers suffer from fewer primary care physicians and even fewer specialists, fewer hospitals, and fewer services at the hospitals that remain, particularly maternity care and trauma, not to mention scarcity of ambulances and clinics. Insurance coverage that's more expensive, 10% higher premiums and even higher deductibles, and even narrower networks requiring significant travel to get care. Doesn't this fly in the face of supply and demand principles? Shouldn't more demand lead to more supply? Next, sadly not. Our for-profit funding of healthcare means that the so-called healthcare providers treat healthcare consumers, and for-profit businesses segment consumers by how profitable they are, as we all know. So poor patients are less profitable than affluent patients. So it naturally follows that areas of densely populated affluent patients become densely populated with providers. In a for-profit system, resources follow the money and they flee rural areas. Let's look at this a little. Across the country, next slide, 166 rural hospitals have closed in the past 15 years, with over 700 currently in dire financial straits. 47 filed for bankruptcy just in 2020, mainly rural. In New York State, 41 hospitals have closed in the past 20 years. Back in 2000, New York had 40% more hospital beds than now. This affects New York City, as we heard a year ago, but it really affects rural New York. Compared to other countries, we have far fewer hospital beds, only 2.8 per thousand people. France has more than double that. South Korea has 4 times as many. Next slide. Manhattan, the most densely populated county in the US, next slide, and one of the most densely populated areas in the world.
Sorry, Judy, it's not advancing here.
Oh, okay. So this is a map of Manhattan with hospitals on it. It reveals its wealthy neighborhoods by their density of healthcare providers. It's a case study of how today's for-profit funding of healthcare concentrates resources to maximize profitable customers. Why don't you stop sharing and start over again?
Yeah, I'm going to have to try that. Sorry.
No, that's okay. Things happen. The Upper East Side, which is the area east of Central Park, which is a green rectangle on the slide, has a dozen prestigious hospitals. This is Fifth Avenue, Park Avenue, Madison Avenue, Gucci, all the places you've heard of. But things look really different in sparsely populated, poorer areas. But, okay, now I need to escape out of this.
There we go. Now let's see.
So if you want to go from there to Manhattan. So you see Manhattan, look at all the hospitals, quick. Really rich, expensive, non-profit, but lots and lots of excess revenue hospitals because they are situated in an area with 168,000 people per square mile and really rich. And I would suggest to you that the reason the hospitals are there is because they are very profitable customers, not because they need that money. Now, if you go to the next slide, what you will see is what the US looks like for primary care providers. The very dark blue on New York inset there are 7 counties with dangerously few primary care physicians. The medium blue simply says shortage. Keep in mind that much rural New York and rural America lack consistent broadband networks, so telemedicine is not an option. Further, there's lack of public transport, and ambulances make emergencies worse. If you look at the entire US map, it's frightening how our rich country, especially our rural and poor areas, lack primary care doctors because they too have to go where the money is. Our rural health outcomes should embarrass us. For example, rural maternity and infant deaths are 2 to 3 times worse than in urban areas. And our urban areas have 2 to 3 times worse than Europe's. Next slide. Consider each of these inset maps of New York. And I apologize for their being blurry. The March of Dimes doesn't give very many pixels. On the left, the dark blue are counties with no hospital or clinic offering maternity care. The medium blue are counties with 1 maternity ward for the entire county. Together, these are half our counties. On the right, the 2 red counties are maternity deserts. No hospital, no birthing center, no OBGYN, no midwife, and 8 near deserts. Life-saving prenatal and postnatal care, it's simply not there. But wait, there's more, and it's worse. The more rural your county, the less likely you are to have insurance. Next slide. 20% less likely. Because New York State expanded Medicaid and offers New York State CHIP and Family Health Plus, more providers get paid when there are providers. But don't assume that a family with insurance can afford cost sharing of copays and deductibles. Half of insured New York families cannot afford healthcare, even though they're insured. Rural families go without care, even when it's available, even when they technically have insurance. But why are rural residents less likely to have insurance? Next slide. Because rural employers are less likely to offer it. I've learned from my Rural Caucus colleagues that more than half of rural farmers take jobs off the farm to get health care for their families. But that doesn't help their workers. Similarly, as we've learned from shocking news reports when the pandemic first invaded rural areas in May to July 2020, meatpacking plants and their tens of thousands of employees don't offer health insurance, endangering everyone in their communities. The same is true for dairies and fruit farms in New York. So rural areas have fewer, next slide, have fewer residents, fewer providers, and fewer services. And our for-profit funding of healthcare means that sparsely populated areas with fewer rich people pay higher premiums. This may have been a profoundly depressing discussion, and for that I apologize. But I believe it's important to learn how broken our healthcare system is. And by that I mean how broken the funding system we are using, how it's breaking the health and spirits of our rural residents, but not only our rural residents, because it focuses on maximizing profits for corporate insurers, not serving public health. Next slide. So what must be done? Broadly speaking, we need to protect rural lives. Too many deaths and illnesses are preventable. We need to protect rural hospitals to keep healthcare workers and access. And we need to protect rural communities, where hospitals are often the largest employers. Protecting them protects the local economy as well as our health. Let's be clear. Out of 17, next slide, and this is my favorite slide, out of 17 developed, nope, back.
Whoop.
Didn't send it to you. Okay, we'll do a shadow show, but you have to imagine is a vertical axis that shows life, where we are on life expectancy, and the US is 17th at the beginning. And that horizontal axis is age, from birth to age 80. And at birth, Americans are 17th out of 17. And our line stays right close to the bottom axis through the 10s and 20s and 30s and 40s and 50s. And in the 60s, it starts bouncing around because at age 65, cancer diagnoses and other serious diagnoses jump 15% above age 64. Why do we think that is? And then suddenly, between 70 and 75, life expectancy for Americans climbs to be the equal of the best developed countries. And this is true for all Americans. All of a sudden, after Americans get Medicare, which is universal, far more affordable, and oh, by the way, every doctor virtually every doctor and hospital takes it. Suddenly, they have the same life expectancy as other countries. And this is also true for rural areas. New York State needs affordable access, next slide, available providers, and equitably high quality care. How do we get this? We have to remove profits from funding and recognize that patients are not consumers. We need to regard healthcare as a public good, something we pay for because individually we cannot afford what we need, and together we can afford what everyone needs. By allowing New York providers to focus on healthcare, not running a business managing insurance, we can help make rural areas more attractive places to live for everyone. Some experts make a compelling argument that these actions will function as an anti-poverty initiative, lifting 20% of New York residents out of poverty almost immediately. The New York Health Act, next slide, which our state league supports, will do this. If you are not yet an active advocate, I urge you, as an advocate for New York, rural New Yorkers, to find out more and to become an advocate. Next slide has a couple of.
Unfortunately, whenever I put my mute on, it screws up your PowerPoint.
That's okay. The next slide only has the website for the Campaign for New York Health, the league website with the health materials, and Physicians for a National Health Program, which also has lots and lots of materials. So I can put that in the chat. Thank you.
And we will have all this stuff posted with the recording on the website, the league website after the convention. So
good. So
if anybody has any questions, you can either put it in the chat or you can raise your hand. Oh, it looks like Regina, you have a question? You need to unmute.
Here I go. I was tremendously impressed by the slides, and I'm very concerned about healthcare and the way it operates today. And I think it is a broken system. Is there any way we can get access to the slides along with the presentation? Not just the presentation, but the slides as well, because they are priceless.
Sure. Kathy just said she'd post it wherever it's going to be posted.
Perfect. Thank you.
And we'll add in that one missing slide.
Yeah,
okay. I think it was an excellent presentation, and I thank you.
Thank you, Regina. Barbara, you have a question?
I was just going to say that today is the last day of the New York State legislative session, and it looks like, and I'm on the West Coast right now, it looks like the New York Health Act is going down. It won't even get to the floor for a vote.
So Barbara, let me just push back at this a little bit. Last night we had a stunning presentation by Dr. Abdul El Sayed. And one of the things he told everybody is think about this like a video game or a pinball game. He said he wasn't sure how many of our audience plays video games, but I think many of us have done pinball every once in a while. And how do you win at pinball? You drop a lot of quarters in. You lose, you lose, you lose, you lose, you lose, and then you win. And once you win on something like this, you don't unwin. People will chip away at it, but once you've got it, you've got it. It's like Social Security. It's there. Medicare, you can poke at it, but it's there. And even the Affordable Care Act, it's still there, even though it's been chipped at constantly. So we need to think about this as not caring how many blocks are in my way. Be the Energizer Bunny, keep putting the quarters in, and eventually you'll win. And I have to tell you, there's a limit on how much of that video we're allowed to post, but that particular section is something I really think we need to post.
I don't totally agree with that, having worked on healthcare for about 10 years now, first on the federal level, advocating for HR 676 because I live down in Virginia. I feel that the healthcare movement is very short. It's a very exclusive movement. It refuses to go to the rural areas. It doesn't want to bring marginalized groups in. This is what I have been seeing with the Campaign for New York Health. I find it very short that way. I think it's critical to get out and listen to people and bring the facts and make relationships. And I did write a storytelling workshop that goes through the process, but it's very critical to get out beyond your comfort level and bring people in and cross those ethnic class and cultural boundaries, or else there's no point. This is a great opportunity. Gottfried, who is the author of the New York Health Act, has been dropping quarters in since 1992 when he wrote the bill. So I don't think that, you know, using a commodity, a money picture.
So the only thing I would say, Barbara, is there is much of what you're saying that I would agree with, but we did not get Social Security for decades. We did not. Medicare took 5, 6 decades. You could argue it started with Teddy Roosevelt. You know, this is not a short game. Yes, we've been at it 25 years.
Well, we've been at it for 120 years for single payer. It goes way back.
But what I would point out is that when Gottfried started, he had no sponsors. 5 years ago, he had he had just enough sponsors in the Assembly to pass it and almost nobody in the Senate. This year, when it was introduced, it had a majority in each chamber, which doesn't make it perfect, but we are farther along than we've ever been. Keep the pressure on, and you're absolutely right. We should all be reaching out to everybody that we can reach out to through relationships, through difference, and not just talk to an expert.
But buyer beware of the politicians who run on single payer and then turn tail. And even the national bills are now have gone.
Barbara, our choice is to give up and walk away, or to deal with the fact that the only way to get the legislation passed is through people who can pass it.
Well, you have to take, from my position, you take a much more moral approach when talking to people rather than a political approach, because you are more likely to look to people's hearts and for the common values. If you leave politics out, yes, we unfortunately have to go through the politicians who all have health coverage and that are sitting in judgment on the common man and woman, and they don't know what it's like. And maybe they shouldn't have health care coverage for about 6 months. Then maybe they'd get it. So
I actually don't want to take it away from anybody, but I think we can agree that a moral approach and an inclusive approach and an outreach approach makes a lot of sense. Is there another question? Somebody else?
I think, did you have a question there or no? No, okay. Barbara Schell.
I think one of the concerns is we need to address mobility. A lot of people, when they're older, they move out of the state. Now, yes, Medicare will go with them, but there is great concern about the many people have earned through their employers the 20% coverage. I think we need to just figure a way to satisfy that issue. Now, to me, and I think there's a lot of opposition because of that. And I don't think I think it can definitely be resolved, but people are afraid about when I'm old, where will I be? But I think the thing is that New York State has to see how financially could it be that they would simply pay the 20% above the Medicare coverage when people move out of state because they need to do it because of health concerns and being closer to their adult children.
Yeah, pay for the Medicare B premiums and Medigap. And that is, I think, one of the things that's under consideration.
That's very good, because I think a lot of opposition, and I belong to some of the civil service union, retirees, and they're in favor of this. But they're very concerned about that particular issue. So I think once we really can have a plan that addresses that concern, I think they will fall in and support the New York Health Act.
So I think a lot of people are very worried about what they're going to lose. And there are ways of dealing with that. And each iteration of this bill over the last 6 years has in fact address some of this. And I think that may be more explicitly addressed in the next year. So good concern.
Barbara, if you get in touch with Misha Sogut or in touch with Gottfried, he's an excellent listener and he changes where he feels he can. If you state your concerns to him, I'm sure you'll have his ear.
Are there any other questions for Judy? I'm scanning. Don't see them. Okay.
Thank you all.
Oh.
You're muted, Kathy.
That was very strange when I muted and it froze up the PowerPoint. That was a new one. Okay, but now it'll be, I won't be muting myself while I'm talking. Okay, here we go. All righty. I just need to, well, I say that. Oh, shoot. All right, now I do know what I did that time, I think. Okay. Sorry about this. You know, it worked perfectly in rehearsal, as they say. Okay. Slideshow. Okay. There we go. All right. Got it. Yes, so finally, I'm going to talk about broadband access in rural New York. And I want to, before I go, another step, I want to thank Donna Seymour, who was enormously helpful finding, many sources and keeping up with local news coverage about this issue. The COVID-19 pandemic has exposed the inadequacy of many things. We heard in part from Judy about inadequacy of America's healthcare service, childcare, elder care systems, all exacerbated by the endemic inequalities in our society. And also glaringly exposed are the gaps in internet access, which have affected everyone from school children learning remotely to employees working from home, to elderly or disabled persons trying to cope with the isolation of life during lockdown. A recent North Country Public Radio story highlighted the situation of a couple who run a lumber business in the rural town of Thurman in Warren County, New York. Internet providers in that part of the Adirondacks have come and gone several times over the years, and loss of service always causes a problem for their business. But this past year, the Martins' grandchildren have been living with them part of each week, so the lack of broadband access has been especially problematic. The NCPR correspondent describes Winnie Martin and her grandson Miles standing in the middle of the road while Miles tries to download his homework on a cell phone because that's the only spot he can get online. I live in the town of Canton, and last year the Canton Central School District purchased 30 cellular hotspots for students without internet access so they could participate in their online classes. Of course, if a student also lived in an area without cell coverage or without a strong enough signal, they were still out of luck. And Canton is only one of 17 school districts in the county that were grappling with this problem. Some used school buses as mobile hotspots. As Jim Siplon, the president of the Warren County Economic Development Corporation, put it, lack of internet wasn't life or death 10 or 15 years ago. Today it is life or death. It's as important as electricity and water. Yet it is estimated that at least 1/4 of rural Americans lack internet access. Simply defining the extent and nature of the problem of broadband access was a challenge even before the pandemic. The FCC acknowledges that their estimate of the number of households without access is too low. If one house in a census block has internet access, the FCC counts the whole block as having it. The widely cited revised estimates produced by the independent research group Broadband Now demonstrate just how low the FCC estimates may be. For example, the FCC concludes that only 250,000 New York households lack broadband, whereas Broadband Now estimates the number is closer to 1,258,600. A few states, Georgia, North Carolina, and Maine, have done their own comprehensive surveys that involve physical street-by-street examination of exactly where fiber optic cables have been run, where satellite or Wi-Fi services are available, and the actual speed and reliability of the service. This is a comparison from the Georgia 2020 broadband report. On the left is the FCC map showing served and unserved areas, and on the right is the map produced by the new, much more granular count. The light tan color designates unserved areas, and you can see the dramatic increase in the lightest color in the after the granular survey. In the North Country of New York, several counties are working with the Nonprofit Development Authority of the North Country, DANC, on a similar comprehensive broadband surveys. And this slide, this is from Lewis County. Lewis County is the first to have been completed, and it has found that 23% of households have no access. When one adds in those whose service is too slow or unreliable to meet their needs, the percentage rises to 49%. And this slide shows the location of the fiber and coaxial cables. And you can see, especially dramatic in the lower right of the map, you can see where the cables end and where the FCC says that the whole block has that service, but in fact, you can see clearly where the cables end, and it's nowhere near most of the block. It's important to check the speed and reliability of broadband access because internet providers are only required by law to report the speeds they advertise, not their actual speed. In addition, there is a problem with FCC minimum speed standards. The FCC sets the minimum download speed at 25 megabits per second, Mbps, but it is widely accepted that 100 Mbps is the minimum necessary in today's world. And again, from the Lewis County survey, green is the fastest, red is the slowest. I like the wry comment by the authors of the county survey. You know, you can see the, the dramatic differences in service. And in the case of these two providers, Verizon and Frontier, it only goes up. The fastest is 25 Mbps. The Albany Times Union estimates that for 31% of New Yorkers, the only internet provider in their area is one whose service meets only the 25 Mbps minimum. Since most rural areas in the state have at most one provider of broadband, it would seem that rural residents who do have access are more likely to be hampered by slow speeds. The St. Lawrence County DANC survey has just been completed, and although full results have not been released, according to an April update, 34% of respondents to the survey report that they could not get the speed of internet service that they needed. A recent New York Times article about the digital divide in rural areas focused on the impact of slow or unreliable internet service on businesses trying to recruit and retain employees. The story used Marion County, Iowa as an example, but this situation is replicated all over the country. Among the reasons that young people don't return to the rural areas where they grew up is lack of access to broadband service of the quality that they've become used to. So why are rural areas so underserved by internet providers? Almost invariably, lack of service in an area means that there are too few potential customers, or that those who are there are too widely dispersed to serve efficiently. And here we have the speed map on the right, and with population density on the left. And purple is lower density, the orange is the highest density. And you can see how often it matches up. And again, we don't have all the providers in the map on the right. But, you know, the higher the density, generally the faster the service, and more likely there is to be more service in that area. If business owners and residents in the unserved areas approach the company that is supposedly serving them about installing fiber optic cable to reach their particular houses, they're almost invariably quoted a mind-boggling price. A recent Adirondack Explorer article on the subject begins with an example from Essex County, where the owner of a counterterrorism consulting firm and his neighbors were told by Spectrum that they would have to pay $50,000 for the installation of half a mile of cable. The little community instead adopted a DIY approach, buying a used trencher and enlisting the services of SLIC Network Solutions, a small North Country communications company that specializes in bringing broadband the last mile to people's homes. This story had a happy ending, but many do not. As Addie Tomer, a Brookings Institute fellow who has studied rural internet issues, concludes, the private sector's not going to solve this problem. What is needed instead is something on the scale of the rural electrification project undertaken by the federal government almost a century ago. To its credit, in 2016, New York did launch a $500 million initiative to connect all unserved households and businesses to broadband service by 2018. Unfortunately, companies have continued to pass over many areas, even while bidding for the state's subsidies. Other factors besides low population density can drive up cost to internet providers. Just this week, legislation was passed in New York State to eliminate the exorbitant fees that the owners of utility poles have been charging companies to rent space for a cable. And efforts continue to repeal a 2019 State Department of Transportation tax on lines that followed highway right-of-ways. The final barrier to internet access faced by some rural as well as some urban residents is the cost. New York State has recently passed a law that would require internet providers to supply low-cost broadband service, $15 a month, to households that qualify for certain federal assistance programs, such as free school lunches or Medicaid. Industry groups, however, representing AT&T and Verizon, have announced they will sue the state of New York for overstepping its regulatory authority by requiring them to provide low-cost service. So what is the solution to the digital divide? President Biden's recently proposed infrastructure plan includes significant investment in expansion of internet service. In addition, calls are growing for states and federal authorities to regulate broadband as a utility. A bill currently in committee in both New York State Assembly and Senate would do just that, and it is supported by NYPIRG, AARP, and Consumer Reports. In the U.S. House, New York Representative Jamal Bowman and Missouri Representative Emanuel Cleaver have proposed the Broadband Justice Act, which would propose regulating as a utility, while Senator Amy Klobuchar and Representative Jim Clyburn have introduced a sweeping broadband package that includes regulation as well as billions for expanding service. In the meantime, rural counties and counties and towns will struggle with how to expand and ensure adequate broadband service for their residents. Canton, population 6,500, is in the process of renegotiating another multi-year contract with our state's sole internet provider. So what can the New York State League do? Well, we could identify state leagues that have or are engaged in studies to propose a position on broadband access. Is this kind of a new problem in people's awareness? So don't know what we'll find. We can define what a New York State position on broadband might mean, might cover, and then do our own study of how best to guarantee equitable access. And I think that both rural and urban leagues would be interested in participating in this. And in the meantime, we can monitor legislation being proposed that would promote increased access and just get the word out to our members about that legislation. In Monroe County, New York, where a third of rural households and 1/5 of urban ones are not connected to the internet, a task force has been formed to study bridging the digital divide. Task force member and county legislator Rachel Barnhart put it this way: everyone has a right to high-speed and affordable broadband. If we want people to fully take advantage of the opportunities available in education and the workforce, we have got to be able to meet this need. So thank you. Sorry for my husband using his manual typewriter there, which was probably quite audible.
So if we have any questions, we can put them in the chat or raise your hand. Regina, you want to? Unmute yourself, Virginia.
Unmute yourself. It's the most repeated phrase of 2020,
And to
21.
get me to, okay. I agree with you. Broadband is essential, and it's a residential entitlement, I think, in New York State. Children are learning through Zoom and other internet services. It's essential for the equitable education of all our children in New York State. Also, medical services, to address Judy's concern in rural areas. A lot of times doctors are able to diagnose in the emergency room through broadband services. They have a psychiatric patient. They do psychiatric services right there in the emergency room via broadband. I think this is an essential service for all New Yorkers. I think it's an entitlement to all citizens. And I think broadband should be dispatched throughout the state. And I think it should be a low budget thing. Verizon, AT&T, they make tremendous profits from these services. Lower income students, lower income residents are entitled to services at a price they can afford. So I'm in.
So Barbara Thomas has her hand raised.
Yeah, I wanted to find out a little bit more about making broadband into a public utility. And I'm a little bit concerned because we don't do a good job of regulating our other public utilities. And I would hope that there's something in the regulation about broadband that would actually make it somewhat affordable for low-income people.
Yeah, I don't know the details there, but you're right. Yeah, the devil would be in the details of this.
So Barbara Gunderson says we need a broadband program like the rural electrification program of the 1930s.
Yeah, I think that's certainly true in terms of investment to just expand, the service everywhere. I mean that, and New York. There, by the way, there is no comparable map. New York State was not one of the states that did a comprehensive survey, but that Georgia map is pretty startling. The difference between the FCC's kind of rosy picture and and what the actual survey showed. So I mean, it's a huge problem. Yeah, Barbara, unmute yourself.
Hear me.
There we
Okay.
go. Yes.
I'm from the Buffalo Niagara League, and we have the second largest city in New York State, but most of Erie County and pretty much all of Niagara County is rural. And our problem is not only difficulty in the rural areas, but we have big pockets of poverty in Buffalo, Niagara Falls, where people 5 blocks from somebody who has good internet don't have it because the companies have not been willing to run cable through those neighborhoods.
Yeah.
So I am saying that once I talk this up, I bet we are in.
Okay, all right. We're gonna we'll line up leagues to do this study. I do think it's sort of astonishing, the idea we would even need to do a study of this, because anybody who's kind of familiar with the situation, has any sympathy at all for the people wrestling with the situation, says, oh my gosh, no brainer.
We have a comment that agrees with you. Sally Grubb says, I'm glad you included the fact that many urban households cannot afford broadband, going to your point. And Sally Grubb, I don't know what league you're from. And Susan Seipert has her hand up.
Listening to issue after issue from the league and many other places, the broadband access sounds like the first one that really could be bipartisan. I mean, healthcare, everything you said about healthcare, Judy, is so true. But try to convince someone who says, get the federal government out of my life, but don't touch my Medicare. I mean, you hear that all too often in rural settings. But broadband is something I think that really could appeal to everyone. So what a great place to put some energy into it. I just applaud you for pointing that out. And I guess from the surveys to say, we really got to do something about this. Just as electricity probably was a very important issue to everyone, regardless of politics at one time. I remember my mother saying in the 20s or going to the 30s, I guess it'd be 30s, on a farm in a rural area, that it was a godsend to the farmers. They finally had pumps and automatic milking machines. It really might be the issue that could really convince people that there's a reason to all talk on the same issues.
Well, what my father used to say, he was an American historian, that in farming communities, when you get up in the winter to feed the animal, you could do it by electric light rather than candlelight, because
Exactly.
It's dark in a barn when you're trying to deal with animals.
Yep.
Well, we got Regina, we got Sally. Sally? Unmute yourself. Sally Grobe.
Sorry, I lost the screen. No, just to say I'm from Tompkins County, and we have low-income people who can't afford access. We have high-income people who can't get access because of the geography of the county. And we have been working for some time to get broadband access everywhere, but the battle with the companies like Spectrum is never ending. And during the pandemic, of course, when all the libraries were closed, children couldn't go to the library to get internet access to do their homework. And it's something I think we can all buy into. A lot of it is, do we have the bandwidth ourselves to take on one more major topic that we're supporting? But it's very important.
Regina?
Yes, I worked for a long time with AT&T, and I look back and I think how dated our communications policy in New York State is. So, for example, I'll give a personal example. I lost all internet services, all wireless services, etc., but I could complain to the PSC because I had no dial tone. And the PSC in New York State worked to get my dial tone back. It involved replacing 5 telephone poles and wires in the backyards, and I'm here on Long Island, replacing telephone boxes, replacing wires to the house, etc. And had I had dial tone, I could not complain that I didn't have internet services. So I think, number one, New York State's communication policies need to be updated. The other thing is broadband is now in the position, technology has moved a long way in the last 20 years. We need it for education. We need it for medical services. We could bring medical services to rural districts by having televised communication between doctors and emergency rooms, etc. We need this tremendously, an updated broadband services policy throughout New York State, so we can service rural as well as urban and suburban districts. It's so important.
2 more questions, and then we will get on to the third thing. Dorothy Hare. Dorothy Hares.
Yes. I would just note to this group that there's 2 counties in Minnesota where you'd be dealing with my relatives. And so there have been a lot of discussions about various things concerning broadband. But when the Postal Service thing started to be heated up around election time, or with some of the decisions that were being made, that is when the group of people that were just a little bit older than me really began to get annoyed. If you're going to touch the postal service, which we really depend upon, then you better be putting something else in. And they became strong advocates of broadband at that point.
Interesting, very interesting. Barb?
I just wanted, am I muted? No.
Oh, I'm sorry. Barb Thomas had her hand up. Sorry.
I wanted to find out if anybody knows if local municipalities have actually worked on forming their own company for their own area. Like I know, say, like the town of Wells has their own electric system. And that seems to me maybe a way to actually keep things very affordable for people.
There has been a bit of that. The town of Nickelville up here near us, it has its own it has its own phone company since 1902. And they also do have some town internet. The problem for them has been some of those fees, the rental fees for the utility poles, the Department of Transportation tax. So there's been other issues there, but yeah, sort of rural collectives or whatever. Okay, I do want to be sure we have enough time for our last topic here. Let me, Barbara, you spoke before. Let me get to Edith Lurvy. Edith? You're muted.
I just wanted to answer the question about places, municipalities working on broadband. The city of Geneva has done broadband for the commercial areas in the center, but they have not expanded that offering to the citizenry based on agreements that they made with Time Warner and the predecessors of Spectrum. So basically, and I'm suspecting that a lot of other municipalities are the same way, that they had these agreements and now they can't offer broadband to the citizenry.
Yeah, exactly. Yeah, these are monopoly contracts that they give to particular companies.
Yeah.
Okay, Leanne Hirabashi of Cooperstown League is going to talk to us about doing league work in rural areas.
Okay, thank you very much, and thank you, Kathy, and Judy, for a great presentation. So let me share my screen and start my slideshow. Let's see. There we go. All right. Everybody can see that? Okay. So my name's Leanne Hirabayashi. I'm currently the co-president of the League of Women Voters of the Cooperstown area. And I'll be talking about, I think we've talked about the digital divide. So we're going to talk a little bit about the red-blue divide and an attempt, kind of a case study on an attempt to try to bridge it and actually also in exacerbate it and try to bridge it and exacerbate it and so on. So so that's what I'll be talking about. And this is actually, even though I'm presenting this was done, a lot of the work was done by quite a few leagues here, and I'll be mentioning them shortly. So let's see. So yeah, so I'll start off just by acknowledging the cast of people that were involved in the various things I'll be talking about. So from the Cooperstown area, Julie Swordson, who was co-president at the time, and then Tom Polyblank and Maureen Murray, who were involved as voter services. And from the Oneonta League, Steve Lawnner, Annette Lindell, and Lisa Samuels. And then from the Mid-Hudson League, Dare, who's here. And actually, there's a number of people who are here, which is great. Sheila Cohen from Cortland, Diane Kahneman and Sally Grubb from Tompkins. And then I'll be talking about the involvement of the organization Braver Angels and the facilitator, Michelle Brody. And then also, interestingly enough, we're going to throw in also the New Yorkers Against Gun Violence, Rebecca Fisher as well. So, let's just kind of give you some context for Otsego County. So here's Otsego County, kind of in the middle of, we talk about being located, centrally located in the middle of nowhere. So if you look specifically at Otsego County, the population is just under 60,000, 94% white. I think, I heard somebody say at one point that it's like the most white county in New York State, but I'm not, I don't know if that's true or not. I just heard somebody say that. 51.5% female. We've got about 3,409 households, about 2.32 persons per household, and the land in square miles, 1,001, and 62.2 persons per square mile. I think, Judy, you mentioned how many people are per square mile in your league area in Manhasset?
Manhasset, it's much smaller than this. It's Upper East Side. Upper East Side is the one I mentioned. 168,000 people per square mile.
Yeah, so it's a little different. And then Cooperstown, the Cooperstown League is located is located around here, and then, or maybe it's right here, and then the Oneonta League is located down here. And then as far as sort of our some registered information about, so what's our breakdown in terms of party affiliations in Otsego County. So it's, while it is more Democratic than it is Republican, it's actually not that different, which sometimes it feels like it's more Republican, but in any event, so you've got, Democrat, Republican, Independent, and this is based on 2017 voters, registered voters in 2017. So again, this just kind of gives you a feel for where we're at. And I'm going to talk about this kind of the long and winding road of 2020 that our leagues took on, and the shape of this. Don't read too like a mountain into this. It was more just what I was capable of creating with my little curves in PowerPoint. So don't read it seemed to be only going in a certain direction. But anyway, I finally got it to turn halfway through. But anyway, so let me walk you through a little bit of some of the things that were going on. So in December 2019, there was a movement that was started to create a Second Amendment sanctuary in Otsego County. And the idea behind that is that the goal would be to pass legislation at the county level that would prevent, or that would basically say that in various ways, and they can specify what those are, that law enforcement, for example, would not be required to enforce any state level gun control laws, for example. So the Oneonta League and the Cooperstown League, we discussed that this was happening and how to respond to it. And so we started working together on that. And then, we're meeting, we're talking about different ways to respond. We're kind of waiting because there's talk of a petition that's being put together. At the same time, there were petitions being put together by those who were opposed to the idea of Second Amendment sanctuary. So there's a lot of talk going on about that. Let's see. And then along, come spring came COVID. And so, that really kind of threw everything there. For example, there was talk about there being in-person meetings where a petition would be, presented. Well, that just completely went out the window. So a lot of the activity kind of went, it sort of got put aside, and yet was still, sort of ongoing. And then you have the murder of George Floyd and all of the protests that came, and that actually, both COVID and those protests, I think, increased the desire among those who were in favor of the Second Amendment sanctuary to really make that happen, because there was a fear, you know, of there's concerns about security and so on. So, you know, this is going on. And then with Zoom, the Oneonta and Cooperstown League actually had held up a primary, our first primary, I think it was, I'm trying to remember, I think it was I think it was the Democrats. So it was a primary candidates night for one of the assembly districts. And we did it by Zoom. We'd never done anything like that before. It went really well. And then, so a few leagues gathered together to start thinking about, could we do this for the Senate district? And so we started working on that in, you know, the beginning of the summer. So this is where we had, you know, the Mid-Hudson League, the Tompkins County, and Cortland and Oneonta and Otsego. And it was really exciting. And we were talking about how we would, you know, let's see if we could get maybe Spectrum involved. So we had to have it actually televised and on Spectrum. And so we Dare had contacts there with, and Dare, I don't remember the name of the woman who was, we had hoped to be the Arbetter, is that right? Is that her name? In any event.
Susan Arbetter.
Yes. Susan Arbetter, thank you. Yes, so she was going to be the, you know, we were hoping she would actually be the moderator, and, you know, things were looking good. You know, we had 3 candidates. We were in discussion. And all 3 initially had indicated, at least, you know, informally, yeah, we're interested in doing this. We were pretty excited. It would get a lot of, you know, it would be seen by a lot of people. And then, so this, again, this is for the general election, but we wanted to start early because there are a lot of players involved. And then, again, as we're kind of moving along with this Second Amendment sanctuary, the Cooperstown League and the Oneonta League published letters to the editor opposing the Second Amendment sanctuary. And as, you know, as part, you know, it's totally within what we felt was, you know, our policy on the league policy on supporting the SAFE Act and so on. So we published these letters to the editor, and the response from the Republican Party chair, that Otsego County Republican Party chair, was swift and immediate, and basically said, my candidate will not be taking part in a league sponsored event. There's no way, because look what they do. Look at them. They're not objective. They're not, you know, there's no way that they will have anything to do with them. And it's important to understand too, is we already didn't have a particularly good relationship with this Republican county chair, but this kind of sealed the coffin, so to speak, for that relationship. Even though the Otsego County, I mean, even though that the Republican candidate had been saying, yeah, I want to do it, he kind of backed down and said, yeah, no, I'm not doing it. So that was the end of this kind of multi-league effort that we were so excited about. Yay, it just kind of died. Now we did end up doing other, like the Oneonta League and the Cooperstown League did do some other, an assembly district general election candidates night by Zoom, and that worked fine. But again, it was just very disappointing that this happened. So then there was the election, of course, and you know the results. And interestingly, while Biden, the Democrats won the election, the presidential election, when it comes to Otsego County, certainly, and most of the legislature, state level legislatures, went all Republican as far as Otsego County was concerned. There was hardly any Democratic wins. So one of the things that my co-president, Julie Sorensen, was looking at was, obviously we've got some pretty, you know, the level of vitriol going on was extremely high. And so Julie had been looking into, is there a way that we can try to have a discussion? I mean, she had reached out to people from the Second Amendment Sanctuary, one of the legislators, and you know, it was very, it didn't go well, is a nice way of putting it. So she thought, you know, is there something that we can do to try to, you know, overcome this divide that's happened? And so she had found out about a program that the organization Braver Angels was doing, which was a program called the With Malice Toward None workshop. And so she worked with local groups to try to put something together where we would kind of pilot test it. And again, for this, we were working with the league, the Oneonta League as well. So what we did is just to kind of give you a quick look at that. So the Braver Angels pledge, the Braver Angels is all about trying to bridge this divide between reds and blues. And so one of the things they were doing with Malice Toward None was saying, okay, this election, incredibly divisive, you know, people are upset, people are happy or upset or exhausted or whatever, but we need to be able to talk about it in some way. So we decided, let's try this workshop and see how it goes with a small group of people. So basically what that was, again, it was a collaboration between the two leagues. There were 2 evenings, just a little bit before Thanksgiving. And, you know, we did wait, we wanted to wait until the outcome of the election had been, at least it was determined who won. At least some people decided that it was that way. Anyway, so what we did is we needed to find, the way it's set up is you find 4 reds and 4 blues, so to speak. You have a facilitator, and you have we had 2 assistants who were league, Julie was one of them, and Steve Laumner from Oneonta was the other assistant. And so we basically recruited a fellow, like in my case, I'm a blue, so I contacted one of my neighbors who I knew was actually, he's involved with the Republican Party, the county Republican Party. So I asked him if he'd like to take part. Other people reached out, and so then we had our 4 and 4. And in the first part of it, that first evening, it was a separate 1-hour discussion. Each group met with the facilitator and talked about. She took us through a series of questions about how we felt about the election, how what we thought were both a kind of an exploration of how did we, what are things about the other group, whether if we're blues as reds, you know, what do we think the reds, what are some of their strengths and their values that we probably share, and what are some of the things that we think that, say, the reds are saying about, would say about us that you might have a kernel of truth. There's questions like that to try to get a sense of is there any common ground, you know, for us. And then in the second evening, what happened is that we sort of had a discussion about some of the things that we talked about, plus a couple more questions. The other group was observing that and then would report back about what they observed, and then we'd switch it around. And that's basically how the session worked, and we talked about how we felt about it. And going into it as one of the blues, I was really nervous. I think there had been so much vitriol and there was so much anger. I was really concerned about how it would make, you know, I think my stomach was sort of churning at the idea of doing this. And I will say that I'm a trained facilitator, and yet I was feeling this way about it. But it went really, really well. And I mean, there were some moments that weren't easy, but I think the fact that the way it was structured, the way it was designed, and was really designed to let's see if we can find some common ground. And out of that, I think what we found is that something that we all had in common was campaign finance reform. You know, the system's broken, we really need to fix it. And so we talked about having a follow-on session where we would do that, where that would be kind of the next piece. Unfortunately, due to the illness and the holidays and so on, we didn't do that. And then with the events of January 6th, I think some people felt even less inclined to do it. So we haven't followed up on it, but it's not to say that I don't think it can work. But basically what I'm just sharing with you is kind of what our experience was. So kind of given that, I'd like to actually have some, open it up to ask you some questions rather than you ask me questions. Although of course you can ask me questions, but I guess what I'd like to ask you is, if we could start, you know, how do we start talking to each other? You know, what are some, maybe you have some ideas about things that we could do for the Reds and Blues to talk to each other in a more, you know, in a civil way, to have a civil discourse about politics and about what we believe. So I guess I'd just like to open up to anyone who has thought about that, if they want to raise their hand or whatever, and we can do that. Or you can ask me a question, either one. Kathy, you're muted.
There we go. Sorry. Barbara Shell has a question.
What seems to work sometimes for me is I start right out, I'm sure there are things we can agree on. And then I look for something, you know, very easy, like the sun is shining. Not quite that easy. It has to be political, but you know, you have to go tread very lightly when you first start. But I had a very interesting conversation with somebody who's very pro-gun, and I'm very much a pacifist and anti-gun. But we did come to a conclusion. He was from New Hampshire, and we did agree that we feel that it's very important for people who have guns to have liability insurance. So we did come to a common thing, and I tell a lot of people now, I carry that with me. If they're very pro-gun, I can tell them that I had this wonderful discussion with this gentleman who is very pro-gun, just like them. But we both agreed that it is important that gun holders have a liability insurance, and that would be, the cost of it would be determined on their performance.
Great. That's, you know, it's a very substantive way, I think, to approach it. And I think that's a terrific idea. I love that.
Yeah, pickup order.
Sure, what can I get for you?
I would like a vegetable
Edith, could you
tempura
mute
dinner,
yourself?
Can we
please.
mute?
Okay.
I don't know who that is.
Anything else?
That's it.
All righty, I'll see you in 15 minutes.
Okay, great. Thank you.
Thank you. Bye-bye.
Bye.
Okay, are you going to share?
Judy Esterquest.
Okay.
Judy Esterquest has a question. She's wondering how scalable would these conversations, the model that you were talking about, the Braver Angels?
Yeah, well, what they talked about is that, so this kind of workshop, I think it could go larger. Certainly you could have maybe more like as many as 8 and 8, but you don't want to make it too big, because you want to give everybody a chance to say something. So yeah, definitely it could be scalable. Now what they have after this, like if you just want to have like these, they have these Braver Angels alliances where you can basically meet once a month or something, or however often you want to meet, and pick a topic and discuss it. And it's a very structured discussion of the topic.
Connie Seifert has a question. And then Ann Erling.
You're unmuted, Connie.
I know. You didn't hear me saying unmute, unmute, unmute. I don't really have a question. I just wanted to make an observation about the Braver Angels. I joined them for a while. I attended a few events, and the first one I went to was awesome. It was on reparations, and I learned a lot, and I really was out of my comfort element, and it was awesome. Then it was about the third one I attended. Someone was speaking who said that it was something about that the Women's March after the election, this was after Trump's election, that the Women's March in Washington had been organized by the Russians, and no one challenged it, and no one said, I mean, it was just, I just kind of lost respect. The ideal of discussing is awesome, but if you don't have someone who's actually, if you're not really talking in terms of factual information, I guess I'm feeling pretty cynical, and I don't see options for dialogue and conversation. I can't even talk with my own family members. We just can't talk about it because we're starting from different sets of facts, and there is no common ground. So I just wanted to add that, and I hope everybody is not where I am.
Yeah, that's a great point, Connie. And actually, I was really interested in. I listened in on a couple sessions, and there was I think John Wood is one of the ambassadors, and he's just an amazing facilitator. And it was a discussion about how the voter fraud in the election. And there were 3 different speakers. They had different perspectives. And what I thought was interesting is there was one who was very clearly believed, that there was all this fraud and that was against Trump. And he at one point there was another guy who said, basically he took this kind of, let's look at every single instance that in the January 6th speech, let's look at every instance that Trump cited about what the problems were. It was this, and he said, and he basically got a group together to research every single one of those claims, and try to include both red and blue as much as possible. And he said, we just didn't find anything. We really looked hard, and it was interesting because the one who was, believed that there was all this voter fraud said, I don't want to get into why are we getting into the details and the specifics? That's not what we should be doing. We should be talking about the broader issues. And the facilitator, the moderator, I think did a great job of saying, I really want to be this guy because he was so amazing. I mean, he basically said, I hear what you're saying. I hear what you're saying is that you would rather not do this. However, I think there is something to really taking a look at the specifics. I think we do need to do that. And is that okay with you if we do that? And the guy said, oh, okay. So it probably depends on the facilitator to some extent, but I agree that the issue of working with completely different sets of facts is really difficult. And I know there's a new program that they have called Walk a Mile in My News, which I'm kind of interested in checking out. I know that my neighbor texted me after our session, some Fox News articles, and I took a look at it and my heart just sank. I just don't know if I started to look at it and I started to feel kind of ill, and actually I ended up actually getting ill. So I really wasn't able to follow up with him on that, but I do want to follow up with him and see if there's some way that we can, have that conversation. I'm sorry to keep talking, but Anne, did you have a question? or comment?
I also have done some stuff with Braver Angels. I did one of their trainings and I've attended a few of their debates, and I have been I just really think they're doing a good job with what they're doing. And I agree with you. Sometimes the statements that are made in these debates are shocking or are on the opposite end of the spectrum of what I have. But I really have very few other opportunities to speak with people or hear perspectives, and I really value that organization for bringing together people who have raised their hand and said, yeah, actually, I do want to be part of this conversation. These aren't people who are siloed and deciding they're not going to communicate. Everybody in this Braver Angels organization has decided, yeah, remaining in conversation is really important to me. So I'm really thankful for Braver Angels. And I think one of the things that I think perhaps your area, Otsego County, a strength of Otsego County maybe is that you are kind of 50-50, divided, so that you actually do have people that you know of who have a different kind of political viewpoint. I think a lot of us are maybe more segregated along red-blue lines. So maybe that's something that the rural areas can help us with, or places. And so I guess then to kind of continue with that, I wondered whether if we did something, a Braver Angels sort of thing, whether we could combine different county leagues. So there might be areas in the state that are more Republican, and we can merge them with areas in the state that are more Democrat and get that conversation group through the league.
Interesting.
Yeah, it's a great idea, Anne.
Well, we are actually out of time here, but this has been fantastic. This is great. And thank you all, and thank you for all the good questions and the good discussions. And again, join the Rural Caucus. Or I'm happy to put anybody just on our email list if you want to keep in touch with these issues and the kinds of things that we're working on. So anyways, thank you all for being here, and enjoy the next caucus or whatever you're going to next, or the rest of your evening in any event.
Can we leave the meeting up for a couple minutes while people who want to sign up for the Rural Caucus can just...
Oh, certainly. I think I'm going to stop the recording.
Stop the recording, but anybody who wants to